The purpose of implants is to add stability to a denture. So when folks ask me, should I replace my denture or not, there are probably a number of different factors that would go into that decision. One is how well is it working for you. Two is the age of the patient. Because one of the things we know about dentures is that there's an old adage that if you don't use it, you lose it. And that applies to the bone in your mouth. So if you don't have a tooth in the bone, or an implant in the bone, then the bone's going to start melting away and melting away. Every time you chew on that denture, you're causing the bone to melt away. So over the years, you're losing more and more and more jawbone, and eventually, and that jawbone is what holds the denture still. So if somebody is saying that their denture is working absolutely fine, and they have lots and lots of bone, then they're an elderly person, and their denture is working fine for them, and they have plenty of bone, they may not be implants may not help them much at all. But I can think of a woman, Candace, who came in needing a new denture because she didn't like hers, it was worn, and we started talking more about her life as a denture wearer. And she started to admit there's certain foods that she wouldn't eat anymore. There's certain types of restaurants she even would avoid because they were mostly salads or mostly things she couldn't chew, and she was embarrassed when she went to those places. So her finances were a little restricted. We placed 4 implants and some new denture, and it just changed everything. She loves to go out with her friends now and goes to the salad place and knows she's not going to be embarrassed. And at the same time, from a dentist standpoint, what we know now is that those implants are going to preserve bone in those areas for her, as opposed to not having those, and the bone would get less and less, and her denture predictability would definitely suffer over the years.